Are you tired of joint pain and want a natural, non-surgical solution that really works? Stay tuned. PRP could be the game changer you've been waiting for. Hello everyone, I'm Dr. Siddharth Tambar from Chicago Arthritis and Regenerative Medicine, expert in regenerative medicine and rheumatology. If you're dealing with joint pain or injuries, you're not alone. Today, we're discussing an exciting natural treatment option that's making waves in the field of regenerative medicine, platelet-rich plasma, or PRP. PRP is a non-surgical treatment that leverages your body's own healing abilities to address pain and injury. It's particularly effective for conditions like osteoarthritis, tendinitis, and even some types of back pain. I've seen firsthand how PRP can dramatically improve quality of life for my patients, so let's dive in and explore how it works, why it's effective, and the science behind it. So what exactly is PRP? PRP is made from your own blood. We take a sample of blood from you and spin it in a centrifuge and isolate and concentrate the platelets. Platelets, in addition to helping with blood clotting, are packed with powerful proteins called growth factors that are crucial for healing. These growth factors do a few key things. They stimulate tissue repair, reduce inflammation, and attract stem cells to the injured area to assist in repair. When PRP is injected into a damaged joint or tendon, these growth factors are released and initiate a cascade of healing responses. For example, they help repair torn collagen fibers in a tendon or support cartilage restoration in an arthritic knee. By enhancing your body's natural healing mechanisms, PRP promotes long-term recovery rather than just masking pain. One of the most well-researched uses of PRP is for knee osteoarthritis. Osteoarthritis occurs when the cartilage that cushions your joints breaks down, leading to pain, stiffness, and reduced mobility. PRP can be a game changer here. The growth factors in PRP not only reduce inflammation long-term, they optimize the joint environment and strengthen supporting ligaments and tendons around the joint. All this leads to better joint stability and less joint inflammation, which in turn leads to reduced pain and better function. Clinical evidence backs this up. A 2019 meta-analysis published in the American Journal of Sports Medicine found that PRP treatment significantly reduced pain and improved function in patients with knee osteoarthritis compared to hyaluronic acid injections and placebo injections. Patients often report relief that can last for 2 to 3 years, which is remarkable for a non-surgical treatment. This makes PRP a promising alternative for those who want to delay or avoid knee replacement surgery. PRP is also effective for tendinitis and sports injuries. Tendinitis, like tennis elbow or rotator cuff injuries, occur when a tendon becomes inflamed or damaged from overuse. PRP helps by delivering growth factors that repair damaged tendon fibers and improve blood flow to the area, which speeds up recovery. Research supports this as well. A 2015 study in the Journal of Bone and Joint Surgery showed that patients with chronic lateral epicondylitis or tennis elbow experienced significant pain relief and improved strength after PRP treatment compared to traditional therapies like corticosteroid injections. And the benefits were not short-lived. Many patients remained symptom-free for a year or more after treatment. This is why PRP is popular amongst athletes and active individuals. It not only reduces pain, but also promotes genuine tissue healing, helping athletes return to their activities faster and with a reduced risk of re-injury. Another area where PRP shows promise is in treating lower back pain, particularly conditions related to degenerative disc disease or chronic inflammation. Lower back pain is one of the most common musculoskeletal issues, often caused by wear and tear on the spine. PRP works here by reducing inflammation around a pinched nerve, reducing inflammation in the vertebral facet joints, and by strengthening the supportive ligaments that stabilize the spine. A 2017 study in Pain Physician demonstrated that PRP injections provided meaningful pain relief for patients with lower back pain caused by disc degeneration. The study showed not only a reduction in pain scores, but also an improvement in function and mobility over time. These results are promising, especially for patients who are trying to avoid more invasive interventions like spinal surgery or steroid injections. One of the biggest advantages of PRP is that it's a natural, low-risk treatment. Since PRP is made from your own blood, there's limited risk of allergic reactions or disease transmission. The procedure itself is minimally invasive and typically done in an outpatient setting, allowing most people to return to their normal activities the same day or the next day. Compared to surgery, which comes with risks of infection, long recovery times, and higher costs, PRP offers a safer and more conservative approach. Of course, it's not a cure-all, and it may not be suitable for everyone. But for many patients, PRP provides a real lasting improvement in pain and function. At Chicago Arthritis and Regenerative Medicine, we take a personalized approach to PRP treatment for our patients. Using imaging guidance like ultrasound and fluoroscopy, we ensure that your cells are injected precisely where it's needed, maximizing the treatment's effectiveness. And because PRP works best when part of a comprehensive plan, we often combine it with physical therapy and lifestyle changes to optimize healing. If you're struggling with joint pain or a chronic injury and want a treatment that focuses on healing rather than just masking symptoms, PRP is worthwhile considering. The best way to know if it's right for you is to consult with a specialist who understands regenerative medicine and can evaluate your specific condition. Thank you for your time today. If you found this content helpful, please like, share, and subscribe. And if you're ready to explore how PRP might improve your joint health, feel free to reach out to us at Chicago Arthritis and Regenerative Medicine. You don't have to live with pain. There are innovative, effective options out there. Live well and take care. Bye-bye.